Welcome to Part 1 of Medication Administration Training for ESY and summer school staff. This training was developed to provide you the basic skills and understanding to safely and appropriately administer medication to students during school hours. There are 4 main goals of this training. The first goal is to safely and accurately administer medications to students while at school. The second goal is to accurately and appropriately document the medication you've given. The third goal is to safely and appropriately store the medication. And the final goal is to maintain privacy and confidentiality of students receiving medication at all times. Medication administration training for school personnel is a requirement of the Drug Control Act of the Code of Virginia. You can read the code above. Loudoun County Public Schools has a school board policy with a corresponding regulation that outlines the required documentation and the types of medications school personnel are permitted to administer during school hours. The policy and regulation outline specific procedures that will be followed when administering prescription medication, over-the-counter medication, herbal medication, and emergency life-saving medication. This policy and regulation can be found on the lcps.org website under Board Docs. According to Virginia State Code, students are permitted, with written authorization from their parent or guardian and prescriber, to self-carry emergency life-saving medications. These medications include epinephrine autoinjectors, rescue inhalers, and glucagon. The school administrator designates staff within his or her school to be trained to administer student medication and provide other health-related services. The state of Virginia specifies that certain employees of a school may decline to provide these services. This chart outlines who can and cannot refuse such services. Aside from designated health office staff, persons hired to render care also include instructional assistants and one-to-one personal assistants. Non-emergency procedures and treatments include, but are not limited to, nebulizers, uncomplicated catheterizations, and uncomplicated G-tube feedings. As part of your preparation and training to safely administer medication to your students, please make it a priority to visit your school health office and become acquainted with the environment and the tools within the office that are there to help support and promote safe and accurate medication administration to our students. The Medication and Health Concerns book contains all medication orders for both prescription medication and over-the-counter medication. It also contains an updated list of students with health concerns to include students who are diabetic, students with asthma, students with seizure disorders, and students with severe allergies who either carry their own epinephrine autoinjector or who keep their epinephrine autoinjector in the health office. This binder also contains individualized healthcare plans, diabetes management plans, and emergency action plans that are all student-specific. Your hands-on portion of this training will provide you an opportunity to review all of these documents in person. The Daily Medication and Procedure Worksheet provides you a schedule of students who are due to come to the health office for daily medication or procedures such as a G-tube feeding or catheterization. This is simply an organizational tool and is not considered formal documentation. Please find and review the 6 Rights of Medication Administration sign. This sign should be prominently displayed in the health office. The 6 rights must be followed every time medication is given to a student. We will further discuss the 6 rights later on in this training. The diabetes log contains daily treatment worksheets for any students with diabetes. More information about this will be provided in your diabetes training module. Stock epinephrine is located in all health offices on the wall alongside an algorithm that outlines the symptoms of anaphylaxis and the actions that should be taken when symptoms are present. Stock epinephrine is intended for students who do not have known allergies or who do not have their own epinephrine at school. Stock epinephrine does not go on field trips. If a student presents to the health office with symptoms of anaphylaxis and does not have an allergy action plan on file, refer to the posted anaphylaxis algorithm to guide your actions. The first aid guide, published by the Virginia Department of Health, is a quick reference guide for school staff to use when providing emergency care to a sick or injured student. All designated health office backup personnel should become familiar with the contents of this chart prior to the necessity of handling an emergency situation. Emergency medications, such as inhalers, glucagon, and epinephrine, are stored in the home ed cart. This cart is kept unlocked during the school day and is taken out for fire drills and all emergency evacuations. The to-go first aid bag is located on the top of the cart and should also be taken out for all school evacuations. All other medication is kept safely secured in locked cabinets. The cabinet locks are color-coded to matching keys. Please ask your health office staff to show you where the keys are kept. Familiarize yourself with which key goes with which lock and how the medications are stored and organized. Locate the health office substitute folders. Inside, you will find the health office visit record, which becomes a permanent part of the student's health record. This form is used by substitutes and health office backup staff to document all medication given and all care provided to ill or injured students. A record should be completed for every health office visit, regardless of the nature of the visit. We will discuss documentation later on in this module. In addition to the health office visit record, the subfolder will also contain blank blood-borne pathogen letters and head injury forms. You will spend more time discussing the proper use of these forms during the hands-on portion of this training. Per LCPS School Board Policy 8420 and state guidelines governing medication administration in schools, all medication given to students must be unexpired and received in its original packaging. Prescription medication must be in its original pharmacy container with a pharmacy label containing the following information: the student's name, the name of the medication, the prescribed dose, and the prescribed time the medication should be given. Over-the-counter medication must be in the original manufacturer's package with the student's name clearly written on it. The manufacturer's dosing instructions on over-the-counter medication must be followed unless a physician's order is provided to instruct otherwise. Pills can never be cut by school personnel. Pills can only be crushed if the authorized prescriber provides a written order to do so. Students are not permitted to carry any medication with the exception of the following: insulin, glucagon, inhalers, and epinephrine. Therefore, all other medication must be delivered to the health office and picked up from the health office by a parent or legal guardian. Controlled medications are prescribed medications whose manufacturing, use, distribution, and storage is controlled by the government. These medications are government regulated because of their increased potential to be harmful or addictive. Medications commonly used to treat anxiety, ADHD, and pain are typically controlled medications. Controlled medications are kept double locked in our health offices at all times. Controlled medications are counted by 2 staff members at the beginning and end of each day and by the parent and school nurse or HCS anytime the medication is dropped off or picked up. The pill counter should always be used to count medication. Wipe down the counter before and after each use. Avoid touching pills, and if you must handle them, wear gloves. Never count pills directly on the countertop. And remember, all controlled medication is double locked at all times. This table shows a list of commonly prescribed controlled medications. Students typically do not take controlled pain medication at school. Controlled pain meds, otherwise known as opioids or narcotic pain medication, may be given during school hours in rare circumstances and only with the approval of student health services. Stimulants are commonly seen in school health offices as they are often prescribed to treat ADHD. Benzodiazepines are a class of controlled medications commonly used to treat seizure disorders. You will learn more about these medications and how to administer them in the hands-on portion of this training. Students with known anaphylaxis should have their own epinephrine and allergy action plan on file in the health office. Student-provided epinephrine, along with a copy of their student-specific action plan, is kept in the unlocked emergency home ed cart. 911 must be called every time epinephrine is given. A parent may not decline EMS transport over the phone. A second dose of epinephrine can be given 5 minutes after the first dose if symptoms don't improve or if they recur prior to the EMS arrival. Epinephrine can be given directly through clothing. While you are administering the epinephrine, someone else is calling 911 and the student's parent or guardian. After administering the epinephrine, stay with the student, elevate their legs, and try to keep the student calm and reassured. The student should not attempt to stand while you are awaiting EMS to arrive. Virginia Code requires all public schools to keep stock epinephrine in school health offices for any student believed to be having an anaphylactic reaction who does not have their own epinephrine or allergy plan at school. Common symptoms of life-threatening anaphylaxis include sudden difficult breathing or wheezing, hives, generalized flushing, itching or redness of the skin, swelling of the lips, tongue, throat, or difficulty swallowing, a tingling sensation, itching or metallic taste in the mouth, agitation, anxiety, panic, and vomiting. Your school may have stock EpiPens or stock AviQ autoinjectors. Be sure to acquaint yourself with whatever your particular school has. Please note there is a junior dose, 0.15 milligrams, for students weighing under 66 pounds. The adult dose, 0.3 milligrams, is used for students weighing greater than 66 pounds. However, there is no need to weigh the student. Just remember that the average second grader weighs approximately 66 pounds. Anyone older than that would require the adult dose. Sometimes a student will need a second dose of epinephrine if symptoms do not improve after the first dose is given. If a student has a known allergy and allergy action plan on file, always follow the individual action plan. If the student does not have a known allergy or does not have an allergy action plan on file, follow this algorithm. Students may present with one or several of the symptoms listed. Don't delay treatment. When in doubt, give the epinephrine and always call 911. As previously mentioned, medication must be received and stored in its original packaging. School personnel may not receive medication that is brought to school in a plastic baggie, pillbox, or generic container. Refrigerated medications are stored in a lockbox inside the refrigerator. All other medications are locked in the cabinets, with the exception of emergency medications, which are kept unlocked inside the portable home ed cart during school hours. Keys to the locked medication must be kept on the school health office personnel at all times or in the possession of the health office backup when the RN or HCS is away from the health office. A spare set of keys should be kept in a designated area that all health office staff, school administrators, and health office backup is aware of. Health office keys should never go home with an LCPS employee. Students are never permitted access to the keys and should never be allowed to retrieve their own medication from the health office cabinets. On the left-hand side of your slide, you see what we call the home ed cart. Inside this cart, emergency medications are stored. This cart is kept unlocked during school hours. In the center of your slide, you see the double lock boxes where controlled medications are kept. Controlled medications are double locked always. Non-controlled prescription medication and over-the-counter medication are single locked behind the cabinet doors. The home ed emergency cart is kept unlocked during school hours. Inside this cart, you will find emergency medications such as epinephrine, rescue inhalers, and glucagon. Medication cabinets are kept locked throughout the day. Behind these cabinets, we store daily medications, prescription medications, over-the-counter medications, open insulin, and nebulizers. Controlled medications are kept double locked at all times. Inside the refrigerator is a lockbox containing unopened insulin or any other medication requiring refrigeration, such as oral liquids and eye drops. This concludes Part 1 of medication training for ESY and summer school staff. Please proceed to Part 2 of this online training.